Good afternoon. Well, good morning. It's still 9:45. I'm already getting ahead of myself, but my name is Shane Kutchell, keeping you company during this 9 a.m. hour. And you might be able to tell my voice sounds a little different, but we're still coming through strong over the airwaves because right now I have in the studio, well, we're going to be welcoming into the KHTS Family Traditions Hospice Healthcare. So I've got my mask on. We have our screen, but don't worry because we have May right on the other side of that. And we're going to be talking about our upcoming radio show. So May, good morning. Welcome into the studio.
Morning, thank you.
You got it. It is really good to have you here. And we're excited. We're going to be excited to have you on the air with us because you're going to be providing not only a unique service to Santa Clarita in terms of the hospice care services, but you're going to be turning that into a radio show. So really looking forward to getting into that. But before we do, let's get to know you a little bit. Why are you doing hospice? What got you involved? Do you have a personal experience? You know, what got you inspired?
Oh boy, that's a loaded question.
Just a small question to get the morning started.
It's a great question. Actually, I've been a nurse since 2009. My background is in ICU, and unfortunately, in my third semester of my nursing program, I lost my first husband to a motorcycle accident. Unfortunately, though, or fortunately for us at the time, he didn't pass away right away. He had to be in the hospital, had significant brain damage. We had to make that difficult decision of taking him off life support,
I'm sorry.
which is a question that I would hope and wish for no family to ever have to make, but we know that is reality, and we all experience death at some point through our careers and our lives, and personal and professional. So for us, having to make that difficult decision, unfortunately, we didn't feel very supported by some of the hospital staff at that time. And so at that point, for me, it was a very pivotal point in my nursing career because I thought, even as a student, what can I do different to make a difference in people's lives and what our experience was? So taking that and kind of hanging on to it for the rest of my nursing schooling and then through my nursing career, palliative care and hospice became a focal point for me and really made me feel like if I can make a difference and make somebody's end-of-life experience positive and something that was more tolerable, because we know that death is really difficult to deal with, but if I could help them through that transition, that was my goal. And so that brought me here to Traditions Health, where I feel so blessed to be, and I've been their nurse practitioner now for over a year. I'm currently the executive director of our Lancaster branch, and we bring a tremendous service to our community and our surrounding communities, even into the Santa Clarita area. So I'm really excited to be here. We're excited to have our radio show starting with you guys, and excited to be here with you today.
You know, all right, I'm only 26, but I've already got Traditions Hospice sort of bookmarked for later in life. That's the exact it's an experience that you wish upon nobody, as you said, but that's the exact type of thing that gives you the emotion and the drive to make sure that experience is as comfortable as possible for other people. I'm sorry that you had to go through that, but it is incredible that you have such a drive and a personal experience to help people go through that end-of-life scenario, because it can be difficult, but it doesn't have to be uncomfortable. So that's incredible that you're going to be able to hopefully offer that sort of emotional support over the airwaves via your radio show, and also that physical love and comfort and the literal life support that some of these people need in those end-of-life scenarios. So that's really cool. So for Traditions Hospice, what are some of the things that make you guys stand out? Why, I'm already compelled to, sign right up and make sure that I'm already at Traditions, but what are some of the things that make you guys stand out from others?
So our program is unique in so many ways. We offer what's called a dual certification. So we have some patients that aren't quite ready to make that really difficult transition from living their daily lives and then choosing hospice, which for patients that have dialysis would mean dialysis would be discontinued. Wow. So with our dual certification program that we offer, patients can still have their dialysis if they have another existing diagnosis that qualifies them for hospice: heart failure, advanced COPD, or cancer where chemotherapy has been discontinued. So we do offer a dual certification program. We also have continuous care for our patients that need it and have difficult end-of-life situations that need to be managed a little bit better, whether it's anxiety or pain. So our nurses can be in the home for many hours, sometimes up to 8 hours if needed, to help manage those symptoms and get their symptoms under control. And then you've got me, of course.
And then,
But not only that, but we do something a little bit different than a lot of other hospices in that I see all of our patients by day 7 of coming on service.
Oh, wow.
Medicare doesn't require that. The requirement of Medicare is that we see them within 90 days to certify them and to say they're appropriate for hospice. But our program has felt that 90 days is a long time for a family to go without seeing a provider, whether it's their nurse practitioner or the doctor. So the doctor who I work with, Dr. Barsimian, he and I take turns and we'll go out and see our patients by day 7. If they're imminent or somebody who's maybe not going to survive 7 days, we try to get out sooner so that we're there to support the family through that transition.
oh, that's huge. That's tremendous. Like 90 days is such a long time. And like you said, that 90-day window, you never know what could happen. So that 7 days, it shows that you really care. That's
Right.
that next level of care that you take, because you just mentioned you don't have to, but you do that. And that's incredible. I had a grandfather taken care of for a while, passed away recently, but just seeing seeing any level of nurse, any person taking care of him, whoever it was, it always made me happy because I just saw somebody taking care of him. So that's cool that you provide that level of emotional comfort in addition to everything else that you just mentioned. So those types of services really make you stand out. That's an incredible level of certification and deep care that you provide for the people that you take care of. But that sounds expensive. What kind of insurances do you work with? How do people cover those costs?
So hospice is covered actually under the Medicare benefit. We do Medicare, Medi-Cal. Most insurances pay for hospice care. It's not an expense to the families. We also have an amazing foundation within Traditions Health. So if we have a patient that doesn't have insurance, doesn't have Medi-Cal, doesn't have a way to pay for it, we do take on charity patients from time to time to help them, because nobody should have to die without the support, not just for themselves, but for their family. So we want to make sure that nobody dies alone. And that's actually our motto, is never alone. So we want all of our patients to know that they are supported through our services, and we're there not just for them, but for their families. Because really at the end of the day, when the patient does pass away, it's the family that's left having to deal with the bereavement and the grief support. So we do also do bereavement support for up to 18 months after a patient dies. So we're still there. We're still there for the family to help support them through this difficult time.
That's huge. I keep saying that, but all of those, it can't be understated, that level of care that you're giving to people. It's family. It's the literal family members. So it's awesome that you are taking that so seriously. It's
Right.
something that can't be understated. It's the end of life scenario. It's a person's actual livelihood. So
Well, and our focus is patient family-centered care, because the family is really the focal part, because they're the ones doing most of the care. Our nurses, come in for a few hours a day to help manage symptoms, to help identify medications that might need to be changed. But at the end of the day, it's the family that's there with the patient 24/7. So we support not just the patient, but the family as well.
thank you for providing all of those services. That is truly incredible, and we've spent a lot of time talking about what you offer to the community, but that's because we want to make sure people know that you're not just here to have your radio show on and sell some spots and make sure you get some people to your business. You're providing a service both with your business and over the airwaves. So we're going to be excited to have you on. Your radio show is going to be starting on September 9th. That's going to be Wednesdays, 12 p.m. to 1 p.m. just after the senior hour.
Right.
And you guys, it's going to be you. It's going to be some other people coming in, right?
Right. So it'll probably be me most of the time. It'll also be Jim, who's our VP of Operations. Will be the leaders of the show, and then we'll be bringing on people that we'll be interviewing. We'd love to partner up with some of our referring partners, pain management specialists, some of your local nursing homes, some of your local boarding cares and assisted livings will be coming in for interviews, because it's such an amazing time right now with COVID. COVID has changed all of our lives, and making it so that we are just an added layer of support to people during this difficult time. It's so hard for families that have family members that they can't visit because they're in a facility or because they're in the hospital. With hospice, it gives them that opportunity to be able to have their loved one at home during their end of life.
That makes a huge difference. That's something I just experienced. My grandfather passed away at the beginning of July, but I hadn't been able to see him for quite a few months. So it's awesome. provide that. What is the phone number that people can call if they want to take advantage, just to sort of get involved with the Traditions family, find out a little bit more?
Wonderful. So our phone number is 661-951-1146. And make sure when you call, let them know that you heard May on KHTS Radio, and you have questions, you have interest in learning more about hospice and the services that we can provide your loved ones.
Excellent. And as part of the KHTS family, I will say we are KHTS, not K-Hits. We do KHTS. No, it's okay. No worries. But that's part of getting used to it. We're really happy to have you, May.
Thank you.
You truly care about what you do. You truly care about the people that you take care of. And that's one of the number one qualities, along with every other qualification you have in the book. So thanks for coming in today. It's great to get to know you. We're going to have you in a couple more times this week to get to know you a little better, talk more about the show. So listener, keep your eyes peeled. Traditions Hospice. And what's your website?
Traditionshealth.com.
Awesome. We've got a phone number, we've got a website, and we're going to make sure those end up in the Facebook comment section. In case you missed it, we have everything for you. Again, thank you, May, for coming in. It's great to have you part of the KHTS family. We're going to take a quick commercial break, then we're going to get you your last look at traffic. It is your hometown station, 98.1 FM, AM 1220.